Hi, my name is Cindy, and I will be explaining and demonstrating how to do a coronal polishing on each quadrant of the teeth. So firstly, I will be discussing the appropriate operator clock position depending on your dominant hand, as well as the patient head positioning for each arch, and the two types of visions that we use in dentistry, as well as what fulcrum is. So if you're right hand dominant, then you should be positioning yourself at the 8 and 9 o'clock position. And if you're left hand dominant, then you should position yourself at the 3 and 4 o'clock position. So I am a right hand operator, so I will be explaining and demonstrating at the 8 and 9 o'clock position. So as for head positioning when polishing the maxillary arch or the upper arch, the patient's head should be positioned with the chin up. And then when you're working with the mandibular arch, which is the lower arch, the patient's head's position should be chin down. So in dentistry, we use two types of vision. One is the direct vision, and then the other one is indirect vision. So direct vision is basically when the treatment area is seen directly with your eyes without using a mirror. And then with indirect vision, that's when the treatment area is viewed with the mirror, with the mouth mirror, because you can't see it directly with your eyes. And lastly, fulcrum. So fulcrum is just a finger rest used to steady our hands when using a dental instruments, and it just kind of helps with staying stable, controlling movements, and working more accurately. So the first thing we're going to be doing is the maxillary arch, which is this arch right here. So we're going to be, I'm going to kind of demonstrate different surfaces and how to fulcrum on each of those and how a patient should be positioned. So we're going to start on the maxillary right quadrant on the buccal surface. So for the buccal surface, your patient's head should be turned slightly away from you, and then dental mirror is on your left hand, just like so. And this is just to use to retract the cheek, and also for indirect vision for the posterior teeth, just like this. And then as for fulcrum, you're fulcruming on the maxillary right incisor. So, right so. Just like that. So on the same quadrant, we're going to move on to the lingual surface. So this time the patient head should be positioned towards you, and then as for dental mirror, it should be on your left hand still, but we're going to be using direct vision now. The mirror can just provide a clear view on the distal surface. And as for fulcrum, you're going to be using, or you're going to be fulcruming on the bottom side or the lower incisor to reach up and polish the lingual surface. So moving on to the anterior teeth on the facial side, so this side right here, the patient's head should be positioned straight forward, and you can adjust it, adjust the patient's head to turn towards you or away from you depending on which tooth you're working on. Obviously we're going to be using the direct vision here since it's on the facial side, and as for fulcrum, you're just basically fulcruming on the incisal edge next to the tooth that you're going to be working on or polishing on, just like this. And then on the lingual side of the anterior, we're just going to have the patient tilt a little bit more slightly upward, just like this. And then we're going to be using indirect vision, so we're going to be using our dental mirror to reflect the light. And then for fulcrum, same thing, we're going to be kind of using, we're going to be fulcruming on the tooth next to which whatever tooth that we're going to be working on. So moving on to the left quadrant, on the buccal surface, we're going to have the patient's position their head tip upward and turn slightly toward you, so you can have a better visual of the buccal side. So your left side should have the mirror to retract the cheek for indirect vision, and then for fulcruming, you should fulcrum on the buccal occlusal surface towards the front of the sextant. So like this. And lastly, for the left quadrant on the lingual side, we're going to ask the patient to turn their head away from you. And then for direct vision, mirror on the left hand, and then you're using that for retraction and also reflecting, so kind of like a combo. And then as for fulcrum, there's a couple ways to do this. So you can fulcrum on the buccal surface on the maxillary left posterior teeth, so like this, or the buccal, sorry, that's one way. So the occlusal part, and then the buccal side too, like this. And then you can also do do it, you can rest your finger on the lower premolar and reach up, just like that. So we are done with the maxillary, so now we're going to be moving on to the mandibular arch. And we're going to start off with the left quadrant on the buccal surface. So for the head position, patient's head should be kind of slightly towards you, so you can see the buccal side more. And then for mirror, you just use it to retract the cheek for indirect vision of the distal and the buccal surface. And then as for fulcrum, so you're fulcruming on the incisal surface of mandibular left anterior teeth and reach back to posterior teeth, so just like this, like that. And then moving on to the lingual side of the left quadrant of the mandibular arch, so now the patient's head should be positioned away from you like this, and then we're going to be using direct vision, and you can use the mirror to retract the tongue and reflect the mirror so that there's more light to the working area. And then as for fulcrum, you're going to be fulcruming on the mandibular anterior teeth and reach back to the posterior teeth. So same thing that we did on the buccal side. So incisor, working area. So moving on to the anterior mandibular teeth. So as for head positioning, there's just straight up, and then you can just adjust, just like the anterior. You just adjust them as you go, so towards you, away from you, tilting up and down, and so on. And as for vision, you can use indirect and direct vision in this area. And then with your left index finger, though, you're using this left finger to retract the lower lip. This doesn't have a lip, so just imagine. And then as for fulcrum, you're just doing the same thing as you're doing on the upper teeth, so you're just kind of using fulcrum next to the working area that you're working on. And then moving on to the anterior lingual side, so same thing, patient should be positioned straight up. You can also adjust them however you want. And then for the vision, for indirect vision, you can retract the tongue and reflect the light. But then if you want to use direct vision, can be used on this particular surface, but the clock position would now be different. So if you're working at a 12 o'clock position, then you can use direct vision for this. And then as for fulcruming, you fulcrum on the mandibular cusp incisal area, so where the canine should be. Like that. So moving on to the mandibular right quadrant on the buccal side or buccal surface. So you're going to be asking your patient to turn their head away from you so you can have better vision on the buccal side. And then you can use the mirror on your left hand to retract and to also reflect light. Mirror can also be used to view the distal surface in this area. And then fulcrum, you're fulcruming on the lower incisor, so like so. And then lastly, on the lingual side, so we're going to ask the patient to turn their head slightly towards you for better vision, and then you're going to be using your left hand with your mirror to retract the tongue. And then for fulcruming, you're also going to fulcrum on the lower incisor, just like this. So a couple things to emphasize before I end this video is the clock position, so how you're positioning yourself and how you're positioning your patient, and also the direct and indirect vision when you're using those things. Those things will really help your posture along the way. So keeping those in mind and making sure that you're using them at appropriate time really help your posture and just not having back problems in the future. And as well as fulcruming. Fulcruming does help with just keeping a stable hand and having more control, as well as our hands are the most important thing in this field. So making sure that you're keeping your hands safe as well as the patient's mouth. Fulcruming is super important when it comes to using any dental instrument, so making sure that that's also being used appropriately. And yeah, so that's it, and I hope you learned from this video, and have a good day.